Hello and welcome. I'm Antonina Antosha and you're watching Head to Head with UATV. Ukrainian medical system urgently needs reanimation measures in the form of structural reforms. The required laws to support the start of the reform have been adopted at the end of 2017, and the reform has been launched with the beginning of this year. What is the roadmap for implementing changes in medical care and other first results to talk about? To discuss this, we're joined in the studio today by Svitlana Bubenchikova, manager of the medical group of Ukrainian NGOs coalition, the Reanimation Package of Reforms. Hello, and thank you for coming, Svitlana.
Hello, thank you.
So, what are the main peculiarities of the medical reform that Ukraine is currently undergoing?
First of all, I want to say that all these adopted laws are a big victory for our society, for our medical system. And we have a chance to develop our medical care. We have several periods to prepare for reform and to implement it. This year, Ministry of Health will change the primary care. First of all, I want to say that from April, every patient have a possibility to sign a declaration with family doctor. We can choose our family doctor not depending of our official registration. For example, I live in Kiev but registered in Chernihiv, and I can choose my family doctor here. From April, start a registration company when every patient can choose a family doctor and sign a declaration with him. From July, National Agency of Healthcare start its work. What does it mean for every patient and doctors?
Exactly. What does it mean for an ordinary Ukrainian?
From July, every signed declarations are legally. So now, before July, it's a testing regime, and from July it became legally.
So starting July of this year, all of those declarations are going to be legalized.
Yeah.
What happens then? For example, if me as a patient, live in Kiev and I have signed a declaration with the family doctor I've chosen, I fell ill, what do I do? Do I have a chance to call the doctor up, or I don't know, fill in some application online and have the doctor come in to my apartment to examine me?
There are several variants because it depends of our patient's illness. For example, if it's an emergency, every patient can call to emergency healthcare.
Yeah, that's what emergency services are for. But what about the family doctor?
Something general situation. So I call my family doctor. We have a conversation with them, and my family doctor should say me if I need to go to him on a visit, or he will come my home and see me and should sign what I shall to do to bring some medicine, some pills, or what diagnostics I should pass.
What other changes does the healthcare reform presuppose in Ukraine?
Before this year, we had such situation. The major number of patients received medical care in places where they registered officially. And today we have two lists of patients, red and green. It's
Who's the red for?
It's about budget. You know that every patient costs 370 hryvnias per year in primary care. So
370 hryvnias per year?
Yeah.
This is a tiny sum of money.
But there are other points that including in this sum. For example, technical assistant of clinics and doctor cabinets. Okay, it's another part. So green and red list.
All right.
The budget to primary care will separate. Red lists, it's patients who are registered, everyone in own regions. And every clinics, government clinics, will receive money for this year,
treatment.
for these lists. But when July came, we will have a green list. It's patients who will sign declaration with their family doctors. And through the year, we will see such things. Red list became short, and green list, real patients with real declarations, with real doctors, will be bigger, longer, yeah.
So once the reform is fully implemented, what kind of result are we going to get in Ukraine in terms of healthcare system?
It's difficult to say, because I think these 2 years will show us not only our victories and changes and more comfortable situation for patients and doctors, but we will see some difficulties. Maybe we should to change something, because our model of this loss of medical reform, it's something unique, something new, and I think after implementing reform in primary care, we will see how many patients we have really because of health, what needs of medical, of medicine, of drugs we need really, and what money, how much we need on primary care. The same is for the second and third care.
Secondary,
but
okay.
yes, it's.
Do you think that once these changes are actually applied and are actually made, that people's trust in state-owned clinics will grow higher than it is right now with the private clinics?
I think the patients who receive medical care in private clinics, they rest in private clinics. But we can see something fighting for patients. The main message of reform is for goes for patients. Yeah?
Money follows the patient.
Yeah.
I've heard that.
And not only money, services goes for patients. Medical reform gives opportunity for doctors to be more independent and for patients to choose the doctor what they want, whom they want.
Well, thank you so much for coming, and thank you for sharing this information with us. That was Svitlana Bubenchikova. She is the manager of the medical group of the Reanimation Package of Reforms. Thank you so much for watching. Stay tuned with UATV.